So this session will be a bit oriented to the business because I'll be showing up a practical application of CakePHP, which we've used to fight against COVID, primarily with regards to contact tracing in Czech Republic. So first of all, the content of this session, the first half will be oriented towards presenting on what is the general overview of the COVID-19 situation in our country and what are the primary means of fighting against COVID. So we will be able to identify what are the means that we need to implement in order to support the business processes of fight against COVID. And in the second half, I'll get, of course, more technical in order to uncover what are the technical sides of supporting these business processes. So for the first part, COVID-19 in general. As we probably all know and have been impacted by it, it's a coronavirus that is transmitted by SARS-CoV-2. It's a virus that has pretty high infection rate, and therefore this is the reason why it affected us so much, that we can actually infect a lot of people just by being infected ourselves. It's called COVID-19 because it has appeared in the year 2019, first in China, and on spring 2020 it has appeared or spread to Europe and USA, which is the period when we also have been brought to this activity. And as of now, the statistics show that there have been around 4.5 million deaths already and more than 200 million cases. So it's something that has a really high impact all over the world. And as we know, because of the analysis of our Ministry of Foreign Affairs, it's an issue that is fought generally by governments all around the world. There are various success rates concerning this. As for Czech Republic, you'll see that we have had like mixed results in this area. Now we've pretty much stabilized the efforts to fight against COVID. So since COVID-19 is with us for already about 2 years, we now have developed a methodology on how to fight COVID that is based on the epidemiology studies. There are 3 basic principles that you need to do in order to fight COVID-19, and then there is the 4th, which I'll mention in a minute. So the main 3 pillars that you need to do in order to fight COVID is you need to test, you need to trace, and you need to isolate. As for the first part, the important thing is that when you are doing the testing, you have to identify the suspects of the infection, and you need to make them undergo PCR or antigen testing in order to find if the case is really positive or it's just a false positive, negative, or some other issue. The second part is tracing. That's the activity we've been active most in the past 2 years. The goal is to contact all positive cases. You need to gather risk contacts from them. You need to talk to them. You need to make sort of epidemiological questionnaire. And based on this, you identify the COVID suspects for further operation. The third pillar is to isolate these cases. You need to isolate firstly the positive cases, the COVID positive patients. And secondly, you need to quarantine the risk contacts that you identified based on these positive cases, which I'll mention later. But generally, these are people that could have been infected by the infected patient, and they could be the infection bearers for the spreading. And the 4th pillar that has come this year is the vaccination, of course. Which goal is to establish a long-term solution in order to mitigate the COVID-19 altogether. So as for Czech Republic, we've had first cases in March 2020. There was immediately established a crisis headquarters by government, but as probably in most of the countries all over the world, these government bodies have very limited IT skills, which was helped by a volunteer organization, which was called COVID-19 CZ, which was established primarily via Slack, or which was coordinated via Slack. It was an organization of more than 1,000 volunteers There was about 25 people that were domain management, and we were so lucky that we could be able to make us part of this organization, of this movement. And one of very important thing is that from this volunteer movement, we've established tracing management, which was sort of responsible for the initial volunteer work on contact tracing in Czech Republic. And we are so lucky that we've made it to the most important 4 people, which were pretty much managing the contact tracing and implementing it in Czech Republic. This solution entirely has been handed over to the government. It's been over a year already. So we definitely have some results from this, and we'll try to go through it later. So as for the timeline, we've been very active in the second or third quarter of 2020. As I said, we've had the first COVID cases in spring 2020. The organization, the volunteer organization COVID-19 CZ was initiated pretty much immediately in about 2-3 weeks. And the first pilot for contact tracing was run in about May. In the third quarter, there was a very important period because as the project was being handed over to the government bodies, we've also been given the permissions or the authority to connect with primary medical systems of Ministry of Health via the CakePHP platform, which means that we've been able to become the most important part of the contact tracing process, and that all the information was exchanged automatically without the need of manual interaction by the users, by the state agency workers, and so on. As you can see in this scheme, there was pretty big cases spike before the fourth quarter. This was pretty much worldwide. But the most important thing is that we've been able to implement all these integrations and automations and solutions before this cases spike, where we've been having over 12,000 infected patients daily. And it's important to know that Czech Republic is a country with only about 10 million people. So we've had pretty big ratio of infected people per capita. I think that we've been during some period we've been also #1 in COVID cases per capita in the world. But the important thing is that we've actually finished all these implementations and this CakePHP platform building before this cases spike has occurred. The most important thing was in September, when we've integrated the primary medical system of Ministry of Health, which contains information about all the infected patients and COVID risk patients, etc. In order to provide you with a reference of the cases count, this is the period which was marked by the arrow in the previous slide. So you can see that we've had during the autumn 2020 and spring 2021 pretty big 3 waves, where we've been also in lockdown and where the contact tracing was very intensive. And the application was having a traffic of around 4,000 to 8,000 unique agents, which have been contacting all these cases and their risk contacts. And this pool of agents consisted of primarily the hygienic station workers, which is around 2,000 people, and they are the main backbone of fight against epidemics and pandemics. We've also already had implemented the professional CC agents, so that the government has been able to hire professional contact center people to help them with the calling activity. Very important part of the fight was the army, which was also integrated in the contact center, and there have been a lot of TV news reports where you would be able to see soldiers in uniforms sitting by computers by the application and calling all these infected and risk people. There has also been a joining of the police because of the sheer scale of the activity. So the government was really trying to get everybody on board who had ears and mouth to be able to talk to the patients. And also they joined the customs administration because the borders were pretty much closed. So there was not very much need for them in order to protect borders. So they used that force as well, and they kind of built the largest distributed contact center in Czech Republic, definitely, maybe in Middle Europe or something, but the scale was really huge. So the landscape of the tools that we've implemented in Czech Republic is quite advanced. I'd say not all of these tools are definitely developed by us. These are just part of the COVID-19 CZ activity, but just to summarize them, we have the certificates validating application. We have the Android and iOS contact tracing application, which we call the e-face mask in Czech Republic in Eruška. Which uses Bluetooth technology to identify risk contacts that are near infected patient. We have the central information line 1221, which you can call for free to get all information, which is also handled by Daktela, but not as part of the contact tracing application. We have a self-tracing application, which is definitely part of the contact tracing, and I'll talk about it later. And one very advanced thing that we've had implemented in the beginning in the pilot, but as it sounds pretty cool from technological perspective, it didn't kinda prove to be useful in fight against COVID. And it is geolocation, where we've been able to deal with the most or the biggest telco operators in Czech Republic. And when the person we've been calling agreed to use geolocation data from his mobile phone, we could see his movement for past 14 days on a map. Just based on the movement of his mobile phone, which is sort of like a spy agency, but it's all based on the voluntary agreement by the end user. And also we had the largest GPS application offering geofencing, which was used also to identify risk contacts, which have been then offered to the agents of the contact center. Which means that if two people with this application have met and one of them became positive later on, the other person will be marked as risk contact automatically within the contact tracing solution. Very important thing was the connection with the health ministry systems, which are 4 main systems which have direct integration within the contact tracing application. The first one is the e-sick note, which means that when you are putting someone into quarantine or isolation, you are able to tell the employer of this person that he's not be coming to work and automatically have him being paid as a sick person. Then you have the e-request application, which is used in all cases of calling to the risk contacts, where you need to send these contacts to the COVID PCR sample collection, and for this you need to have this request created for you by the agent of the contact center. Then you have the vaccination API, which you would use to verify which people are vaccinated and not to be considered risk contacts. And last but not least, it is the main medical system that contains all the information about infected patients. So as I said previously, the main goal of the contact tracing application is to contact the COVID positive patient and to gather the risk contacts, which are the people that this COVID positive patient has been in contact 2 days prior to first symptoms of the infection, and that have met each other for over 15 minutes under 2 meters and some other criteria. So you need to get these people on the right side of this image, and you need to put them into quarantine. As you can see, the contact tracing process is sort of complicated or complex. It's about 12 steps where you need to suspect the person who is positive. You need to get this information from the information system. You need to import them into the contact center application, and you need to perform many automated tasks, which I'll mention some of them later. It all starts with the health ministry and ends with the health ministry, as they are the primary authority for the health data. So how did we implement the fighting against COVID-19? Firstly, what we need to know is that we've used Daktela V6, which is like a standard application for contact centers. It's an omnichannel solution. It's not actually built on CakePHP. That's something that we've used in the other application that handles the COVID-19 task specifically. It's important to know that this is like a standard application for contact center, where we've used the company management solution for customization of the COVID-19 process. As I said, for the contact tracing application, we've used the campaigns module for the outbound calling. One of the important things is that each hygiene region required to have the data separated from each other. So they needed to have their own campaigns, their own queues for COVID positive and risk contacts. They needed to have all these data isolated and had to have an ACL rules set for them. So each hygiene just worked for themselves, and within some busy periods, they would be able to help each other based on the requests made on the support service desk, which would then alter the permissions for each of these queues. On the right side, you can see the practical use of the Daktela of the company management. This is something that the agent is filling in, and this is the like resulting form of the data that we need to extract from the positive and the risk contacts. One of the very important things is that for the contact tracing application, we've used many customization tools, but two of them are the mains. The first one is widgets, and the second one is events, and I'll talk about this later on. So this is the screen that the agent sees when calling the infected or risk patient. The important thing is that down in the bottom, you can actually see the application that is built upon CakePHP, which contains these widgets. So this is the Daktela, this is just a standard package, or this is the standard package that of the application. This frame in the bottom is the custom-made application for handling the COVID-19 contact tracing. Yeah, it's definitely in Czech because all of the tracers are in Czech, but I'll try to describe it in English. So one of the main modules, for example, was the creating of the risk contacts, which was a widget that handled the relations between infected and risk patients. There was the address book integration for all addresses in Czech Republic. So when you are identifying a risk contact, for example, the places they've met on, then the address had to be specified uniquely using some ID that is in the national register. Then we've had the integration for e-face mask. We've had the isolation counting widget. We've had the vaccination check widget. We've had the e-sick note widget, and then we've had many other widgets, and one of them, for example, was the collective notifications, which in this case meant that if you identified that some person met, for example, for over 20 people, then it was reported to hygiene as a very problematic case. This platform that we built for the contact tracing, we've called it Trasovani-custom, which is like tracing custom application, and it's hosted on separate site apart from the main omnichannel solution. So the two main components of the Trasovani custom or tracing custom are events and widgets. The Daktela V6 actually had two deployments, one for the hygienic workers, one for very large or thousands of people that were from the professional contact centers, and used some sophisticated data pumps which move data back and forth using the tracing custom application. The primary tool for this was the event. Then there was the widgets part, which you've seen on the previous slides, which was the lower part of the contact tracing form. So as for the platform itself, it's built using CakePHP 4. It of course uses Composer. We've implemented Yarn for this. We are using PHP CS and many other tools. And there are four main components which are described technically in detail. We've had the AuthController, we had the event controller, we've had the widget controller, and then we've had the user access controller. And I'll explain these separately in a minute. So the first one was the AuthController. The task of this controller was to identify for the application the user that has been authenticated in the Daktela V6 solution. Because we didn't have the user authenticated directly in the tracing custom application, we've had him authenticated in Daktela V6, and there was no big chance to use some SSO solution. So we've prepared the AuthController that just overtakes the session information from the main application. It loads the information about the user, saves them to the session as well, and offers them to other parts of the application, primarily the widget controllers, which are used on the presentation side of the application architecture. It handles basic user tasks. It initializes the Daktela client, which is used to connect to the Daktela V6 application. It, for example, loads shared filters on various grid views in the application, and it handles cookies for the users. The second important part is the event controller. I think that this is a really important part of this because A lot of the tasks that happen with the infected and risk patients in Daktela are automatic and require like complex manipulation. The event controller is triggered whenever any change in data occurs, so it's sort of like a webhook. It contains enumeration of events, which we call modifiers. These modifiers contain encapsulated logic, which says for each record how this record should be changed, on what rules, what are the conditions for the change, etc. And in the end, they return the modified object back. As I said, each event contains internal logic, it contains conditions and the execution contains the modification application. And one of very important thing to lower the rate of data that is written to database, etc., is that we've implemented change detection before the object is persisted into database. So whenever no change occurs, we don't do the persistent actions, for example. So, for example, these events would be that you would want to import data from e-request system, from vaccination system. You would want to prioritize some records, for example. You would want to create collective notifications. You would want to autofill important attributes, etc. This is how the core logic works. In the beginning, you can see that we load the data from the application. We load the events enumerator, as I said before, and then we just one by one apply the events to the object in here about, and yeah, in here, this is the execute method. And for example, when a change is detected in the object, based on the previous iteration, it parses the data into the application. So this is the logic that we've used to lower the amount of I/O operations on the application. Third part of the application is the widget controller. It is the parent of all the widgets that you've seen in the lower part of the application. It contains shared logic. It contains the user identification and provision to the child classes, which means that, for example, you would have a widget that would work with the sick note application. It would be a child of this widget controller. It would use some generic methods from this class. And for example, this widget would be as well used for the routing definition for individual widgets. This is the structure that is implemented in the application. So you can see that there is like a various cases or various variants of the widget. For example, widget risk controller, widget sick note controller, and each of these widgets, they contain their own presentation layer and their own business logic, but they share the widget controller logic, which contains the basic information about user identification, instance identification, routing, and it provides the children with access methods. And also, whenever there is an integration, we've created a namespace for all the integrations with ministry applications. This is the class that spawns the clients and the instances and singletons and everything for the child widget controllers. The fourth part, which is like a minor part and is just like supporting component of the application, is the user access controller, because when you have like 8,000 agents and they swap about 500 agents each month, you need to have an automated means of creating and deactivating users. So we've built a small application just for this, which we've exposed to the administrators of the external contact centers. So whenever the contact center hires a new agent, the process is fully automated. This is like really a small application built in CakePHP. They would create the user, deactivate the user, and do everything they need using this controller. And this is like an add-on to the entire contact tracing solution. This is self-tracing, because there was a big workload on the agents, and when you are hitting 12,000 cases every day, you are not just able to call them all. So we built this self-tracing application where we just send the infected and risk contacts a deep link to their own form, where we just gather the information from them, from their computer, from their mobile phone. You send some unique identifiers to them, and then if they enter all the information correctly, if the data is validated against all the registers, all the automation takes place. And for example, You don't even need to talk to an agent to discover that you've been a risk contact. You input all the information about yourself and you just get the request for the PCR sampling automatically, and you just go whenever you want to any collection place. So you don't have to talk to a person in order to be traced, to receive a PCR test for free without any payment, and to have all the information about your quarantine and everything really. So using this solution, we are eliminating, let's say, about 40 to 50% of contact with the people altogether. So this is the self-tracing process when implemented. The self-tracing is triggered after a risk contact is identified or after a positive case is imported into the system. It consists of receiving the text message by the end user, filling in the form in a responsive application. Then all the information is checked against the medical systems of the health ministry. And if the validation is successful, then all the information about the contact is closed and the data is exported to the external medical systems. So I'll just show in a few slides how the user journey looks from the perspective of the infected patient. So you can see all the applications one by one, how they fall into the chain of events. So the first thing that you do definitely is you'd go to some of these boxes to have your PCR sample collected from your nose or from your mouth. If you've been, then of course this sample is delivered to the laboratory where you've been tested for the PCR for the COVID-19 presence. If you've been deemed positive, then the laboratory enters these results into the health ministry register of infected people. Your case is automatically created in Daktela V6 using the importing job, which runs in PHP, CakePHP as well. Then the automated processes are triggered. So, for example, you are being prioritized based on the COVID variant you've been identified with. You would be prioritized if there will be if you'd be a part of a risk group, for example, if you'd be a senior or some part of a large collective. Then if there are rules for auto-assigning your case because of the collective to some dedicated workers, then this would happen. You'd receive your automatic e-face mask code for the Android and iOS application. We would import more information from different medical systems. You would automatically send you a self-tracing code or apply some other rules. The fifth step would be that you would receive the self-tracing code, which is like a text message that contains the information about your positivity or that you've been part of the contact tracing, that you've been probably infected. You receive a deep link to the application, to the self-tracing, and you can enter the code and PIN to fill in the form. This is just an optional step. You can definitely fill the self-tracing, and this helps the entire process and the entire system very much. So this is how the application looks. It's built on CakePHP 4. It's actually a separate platform from the main contact tracing, and it contains several steps where you would just enter your personal information. Then, if you wouldn't fill the self-tracing, or there would be some problem with data, you would get imported into the agent screens or into the distribution system on the contact centers, where the agent would call you. They would use the WidgetController and related widgets to fill in all the data that we need from you. It's a call that takes, for example, 20 to 30 minutes, which is not really short. And they would use all the tools that they have available, for example, the vaccination check, the e-sick note, the collecting notifications, the isolation counting, the e-face mask, etc. And they would fill this information with you and generate the risk contacts from you. This is the 8th step, the generating risk contacts, where they would just ask you who you've met, on which occasion, when, for how long, under what terms, etc. And the last step, where it all ends, is that we need to give these information back to the health ministry, to the medical registry of infected people. So we would update the information about the positive case, which is like really a lot of data, and we would create all the risk contacts in the system, so that the ministry can, for example, send you a letter that you've been quarantined and perform their own legislative actions. And the last thing is that we would try to process the risk contact, because this was the case for, or this was the process for the infected patient. So we would then process the risk contacts in similar manner. So we would trigger the event controller on the tracing custom for the risk contact chain of events. We would generate the self-tracing link for the risk contacts. You would prioritize the risk contacts case based on some parameters about the people we've gathered. There are pretty complex rules for the distribution to agents, because, for example, if the person says that he can't come to the collection place, you would want to send him an ambulance. So, for example, you would prioritize these people first. Then you would prioritize the unfinished self-tracing forms, because some people just can't fill in 100% of the data right. And I think that the user experience from this prioritization and this distribution rules is kind of positive, because just imagine that you receive a text message with deep link to your own self-tracing form. You fill in the form, you make a mistake, and within 2 minutes, an agent calls you and just fills in the remaining data or the error nodes data with you on the phone. And in 2 minutes, you receive a text message about the PCR test voucher being created for you. If I would have to conclude the success of the project, imagine that with 10 million people, over 1.5 million positive cases have been processed by the system. We generated over 2 million people. So this means that almost half of the population has been processed by the contact tracing already. And for like long term, the contact centers with all these people have reached the KPIs of having over 90% people having reached within 24 hours, which is valid for either the positive cases and for the risk contacts. So this pretty much says that the system is kind of working, even though the political argumentation and discussions try to suggest otherwise. But the KPIs of the entire process and of the entire tracing solution prove that the solution is just working and that the strategy is executed just right.